Let me ask you something that many men think about but rarely say out loud. What actually happens if you ejaculate every single day? Is it healthy? Is it harmful? Could it boost your performance or slowly drain your energy over time? If you've ever wondered about this, you are far from alone. This question comes up constantly in conversations with men of all ages. It tends to live in the background of men's lives, surrounded by half-whispers, myths, jokes, and sometimes guilt. And yet, it's closely tied to men's health, relationships, and confidence. So today, let's talk about it honestly. My name is Dr. Evelyn Hartwell, and I'm a board-certified urologist with over 12 years of experience helping men better understand their sexual and overall health. In this conversation, I want to give you a clear picture: the potential benefits of ejaculating daily, the possible downsides, and most importantly, how to figure out what's right for your own body and your own life. By the end, my hope is that you'll feel informed, confident, and free of shame or confusion. Let's clear up the biggest misconception right away. There's no single universal answer. Ejaculating every day is not automatically good or automatically bad. It depends on why you're doing it, how it affects you, and what's going on in your health and relationships. Some men feel great with daily ejaculation. Better sleep, less stress, improved mood, and a sense of release. Others may notice the opposite: lower desire, feeling drained, or changes in performance. So the truth isn't black and white. It's about context, your biology, your habits, and your stage of life. If you've ever felt unsure or confused about this topic, that doesn't mean you're uninformed. Most men were never properly taught how their sexual health actually works. Very few receive clear, science-based education about masturbation, ejaculation, hormones, or prostate health. That's one of the reasons I talk about this subject so openly. After more than a decade in urology, I've seen how much peace of mind men gain when someone explains things simply and respectfully. Think of this as a doctor-to-friend conversation. My goal isn't to judge you. It's to help you understand your body so you can make choices that truly support your health and happiness. Let's talk first about the benefits men often experience with regular ejaculation. One of the most noticeable effects is on mood and emotional balance. After orgasm, your brain releases a mix of chemicals: endorphins that reduce pain and tension, dopamine that fuels reward and motivation, oxytocin that creates warmth and connection, and serotonin that helps stabilize mood. This combination can leave you feeling calmer, lighter, and more relaxed. Many men describe it as pressing a reset button for their nervous system. It doesn't solve every problem in life, but it can help release built-up stress and physical tension. Another common benefit is improved sleep. It's no coincidence that many men feel drowsy or deeply relaxed afterward. Hormones like prolactin increase after ejaculation and are associated with feelings of calm and sleepiness. When paired with the stress-reducing effects of orgasm, this can help some men fall asleep faster and sleep more deeply. For those who struggle with busy thoughts at night, regular sexual release can sometimes quiet the mind enough to rest. Ejaculation is also part of a larger physical response. Sexual arousal raises heart rate, increases circulation, and engages muscles throughout the body. It isn't a substitute for exercise, but it does stimulate your vascular system. For some men, regular sexual activity is linked to better erection confidence, a sense of vitality, and feeling more connected to their body. There is also research suggesting a possible link between frequent ejaculation and a lower risk of prostate cancer. Large observational studies have found that men who ejaculate more often, roughly 21 or more times a month, may have a slightly reduced risk later in life. One theory is that ejaculation helps clear the prostate of fluids and old cells. This isn't a guarantee or a medical treatment, but it's an encouraging potential benefit. Regular screenings and medical care are still essential. Another interesting effect is on the immune system. Some studies have shown that sexual arousal and orgasm can increase certain immune markers, such as immunoglobulin A, IgA, which plays a role in defending the body against infections. Combined with the stress-reducing effects of sexual activity, this may give a small boost to overall immune resilience. But to be balanced and honest, ejaculating every day isn't risk-free or universally helpful. For some men, it can become less of a choice and more of a compulsion. There's an important difference between consciously deciding to masturbate because it feels good or relieves stress, and feeling driven to do it even when it interferes with life. If ejaculation starts replacing sleep, work, relationships, or responsibilities, that's a sign it may be becoming problematic. Over time, compulsive patterns can affect the brain's reward centers, and emotionally they often bring guilt, secrecy, or shame. A useful question to ask yourself is, am I choosing this, or does it feel like it's choosing me? Another possible drawback is using ejaculation as the only coping strategy for emotions like loneliness, stress, or sadness. There's nothing wrong with enjoying sexual release, but when it becomes the main way to escape difficult feelings, it can hide deeper needs, such as connection, rest, support, or meaningful activity. Emotional health usually requires multiple tools: exercise, conversation, self-reflection, hobbies, spirituality, therapy, or community. Ejaculation can be one of those tools, but it shouldn't be the only one you rely on. Fertility is another area to consider. If you are trying to conceive, daily ejaculation may temporarily lower sperm concentration because the body needs time to replenish sperm stores. This doesn't mean complete abstinence is necessary, but spacing ejaculation every 2 to 3 days during a fertility window can sometimes be helpful. If you're not trying to father a child, then this isn't a major concern, but it's useful to know. Some men also notice reduced sensitivity, pleasure, or desire when they ejaculate very frequently, especially if the experience becomes rushed or repetitive. The brain adapts to whatever it experiences repeatedly. If sexual stimulation becomes quick, mechanical, and predictable, desire can flatten over time. Short breaks or changing habits can often restore sensitivity and interest. Performance can be affected as well. If ejaculation usually happens in a hurry, the body may learn to respond rapidly. This can sometimes contribute to problems like finishing faster than desired with a partner or feeling performance anxiety. It's less about frequency and more about style, speed, pressure, and mental state. Slowing down, being mindful, and focusing on sensation rather than racing to the finish can make a real difference. So what's the bottom line? Ejaculating every day is not automatically healthy or unhealthy. The real question is how it affects you. Do you feel more relaxed or more drained afterward? Are you sleeping better, or are you staying up later just to do it? Does it support your confidence and connection, or does it interfere with intimacy or goals? Your body provides feedback all the time. Energy levels, mood, libido, motivation, and relationships are all signals worth listening to. It can be helpful to experiment gently. Try different frequencies and notice how you feel physically and emotionally. Pay attention to whether you use sexual release mainly for pleasure and connection or primarily to escape discomfort. If you are in a relationship, honest conversation can deepen trust and understanding for both partners. If you ever experience persistent pain, blood and semen, major changes in erection quality, or significant distress about sexual behavior, it's important to talk with a healthcare professional. These are medical issues, not personal failures. If you've carried shame or confusion about masturbation or ejaculation, you're not alone. Many cultures avoid open conversations about sexual health, leaving people to guess or rely on myths. Asking questions shows maturity, not weakness. Your sexual health is part of your overall health, and understanding it gives you more control, not less. Here's the encouraging part. You are not stuck with one pattern forever. You can adjust your habits as your life changes, during stressful periods, in relationships, when focusing on fertility, or as you age. Small shifts like slowing down, taking breaks, or being more intentional can increase energy, confidence, and satisfaction. Vitality does not disappear with age. Whether you are in your 30s, 50s, or 70s, your body is capable of adapting and thriving when treated with awareness and care. To round this out, let's add a few related thoughts that often come up with this topic. First, frequency of ejaculation does not define masculinity. There is no right number that proves anything about your strength, attractiveness, or manhood. Some men feel healthy with frequent ejaculation, and others feel best with less frequent release. What matters is alignment with your values, your health, and your life. Second, pornography can influence this discussion. For some men, daily ejaculation is closely tied to porn use. While not everyone experiences negative effects, excessive porn consumption can sometimes distort expectations about sex, bodies, and performance. If you find yourself comparing real life to unrealistic content or needing more extreme material to feel aroused, that's worth paying attention to. Reducing or taking breaks from porn can reset sensitivity and reconnect you to real-life sensation and emotion. Third, lifestyle matters. Sleep, diet, exercise, stress, and mental health all interact with sexual function. If you're constantly exhausted, sedentary, or highly stressed, changes in libido or erection quality may have more to do with overall health than ejaculation frequency alone. Sometimes improving general wellness naturally improves sexual health as well. Lastly, remember that intimacy isn't only about orgasm. Connection, affection, laughter, conversation, and presence all contribute to a fulfilling sexual life. Ejaculation can be part of intimacy, but it is not the only measure of it. In the end, the key message is simple. Daily ejaculation can be healthy for some men and unhelpful for others. Listen to your body, respect your mind, notice your habits, and don't be afraid to talk openly about sexual health. You deserve clarity instead of confusion, confidence instead of shame, and choices that genuinely support your well-being.